special educators support their students in many ways. Today, you'll be introduced to an important service for students with intellectual and developmental disabilities. Care Coordination, a service of the New York State Office for People with Developmental Disabilities, or OPWDD, offers students and others with intellectual and developmental disabilities professional help to find, plan, connect, and coordinate disability services so they can live a better and more fulfilling life. To get started with OPWDD, students go through an eligibility process and are connected to a care manager, a valuable resource of the CCO or Care Coordination organization. Care managers assist with getting services in place for your students based on their wants and needs. Care managers support students at all ages and stages of life with an individualized approach, recommending plans that are tailored to the needs of the student. Led by the care manager, each plan is created collaboratively with people who are in the student's circle of support. This means the care manager joins with parents, guardians, school staff, healthcare and behavioral health professionals, and others to create a support system to connect the students to services outside of the school system. Care managers help students access services and resources like respite to give families a much-needed break from care, community and day habilitation, after-school programs and summer camps, grant-funded behavioral support, many types of recreational services, and family reimbursement. Assistive technology and e-modifications to enrich students' lives at home and at school. And when the student approaches adulthood, the care manager can help with transition planning that can open doors to employment, housing, and day service programs. Care managers may follow and support the student's healthcare needs, tracking annual visits, emergency treatments, and other relevant medical appointments to maintain optimal health. Behavioral health care is an important aspect of many students with IDD. Care managers connect students and their families to skilled professionals when that type of support is necessary. In many ways, care managers can be a significant resource for transition coordinators, social workers, and school staff who need to connect students and their families to services. Each person who enrolls for Care Coordination chooses from one of the 7 CCOs in New York State. Enrollment specialists at each CCO guide the referral process, assist with documents and follow-up to ensure the students get through the process with their family's involvement. To qualify for OPWDD care management services, the onset of the disability must occur before the age of 22, must be indefinite in duration, meaning it is not something that will go away, must have an impact on adaptive ability, and it's important to know that the diagnoses that qualify an individual for care coordination services vary from person to person and include but are not limited to these categories. For example, a person with autism does not automatically qualify for OPWDD services. The degree of autism and the overall impact the autism has on adaptive ability determines eligibility. In another example, a person with Down syndrome typically falls under the qualifying diagnosis of intellectual disability and will most often qualify for care coordination and other services on that basis. Regardless of OPWDD's determination, no referral goes unnoticed, and with the help of a care manager, students are connected to services that fit their needs if determined ineligible. Whether the student and their family are newly diagnosed or are many years into the journey of living with a disability, a care manager can be a huge benefit for guidance and navigating a complicated system, to gain answers to tough questions, to connect with resources such as physicians, support groups, and community programs, to provide a robust plan of action that includes accessibility to resources. The care manager serves as a liaison between the family and the school, facilitating coordination of meetings and maintaining communication about the student. Teachers and special education professionals can rely on the work of care managers who complement the work already being done to support students and families. ACA NY is committed to partnering with school district professionals to get special ed students the support and services they need to thrive and become their best. Referring is as simple as a call or click to submit contact information. To get students started, teachers can share this information with families to refer their child. It only takes a few minutes, and families receive a call back within 24 hours. Connect your special needs students to ACA NY Care Management Services. It's easy, it's available, it's what students, families, and teachers need.